Heavy periods is one of the most common problems that women suffer from. It is so common that 1 in 10 women worldwide and 1 in 6 women in India are affected by it. Let's try to understand this problem and learn how we can solve it. Hello everyone, I'm Dr. Pranay Desai, Gynecological Endoscopic Specialist and a Cosmetic Gynecologist practicing in Mumbai, India. Here is an entire webinar which I conducted recently with JS Finserve on heavy menstrual periods, where I discuss in great details about what normal periods are, how periods occur, what defines abnormal periods, what are the causes of abnormal bleeding, its treatment, and how we can prevent this problem. Since this video is very long, I have included timestamps in the description below, and you may fast forward to the part that you like. I hope that through this video I am able to solve your doubts regarding menstrual abnormalities. Feel free to like, share and subscribe so that as many women as possible can benefit from this video. Enjoy.
Dr. Pranay Desai, thank you for joining. My name is Ishika Kundar and I'm an operations intern at JS Finserve. JS Finserve is a financial boutique incorporated in the year 2013 and at present having over 1,000 plus satisfied clients. We pursue tie-ups with over 40 banks as impeccable authorized loan consultants, including various tie-ups with 45 AMCs and 30 insurance companies. Today, we have with us Dr. Pranay Desai, who is a board certified obstetrician and gynecologist. He's a consultant gynecological endoscopic surgeon and a cosmetic gynecologist in Kemp's Corner, Mumbai. He is the founder and director of Aegis Clinic, Aesthetic Gynecology and Endoscopic Surgery. He has taken specialized training through a fellowship in advanced gynecological endoscopic surgery at Mumbai and Ahmedabad, India. He has completed his fellowship in cosmetic gynecology from the Aesthetic Rejuvenation Institute, New York, USA. He is experienced in the latest and the best techniques in treating gynecology conditions, which includes the minimally invasive surgery, laparoscopy and hysteroscopy. He also specializes in cosmetic gynecology, a novel field in gynecology which helps women aesthetically as well as functionally improve their private parts. He is also associated with Wockhardt Hospitals, Mumbai Central, to give meaning to the hospital's mission of making life win. The hospital has strengthened its clinical expertise by involving some of the topmost clinicians across specialties. Whether it is heart, brain, spine, joints, kidney, digestive, the doctors at Wockhardt have a collective experience of more than 10,000 interventional procedures and surgeries in each specialty. They are also experienced in performing the least invasive surgeries in all specialties. I would also like to welcome Mr. Rohidas Lokhande. He is the president of Pragati Pratishthan, vice president of OBC Morcha for Maharashtra state, and special executive officer in the government of India. He has done a lot of social work in fields of helping widows, handicapped, specially abled, and women empowerment. He, along with his wife, Mr. Surekha Lokhande, also conducted yoga camp classes and kabaddi events for women in the Baikala region. He also spread awareness for the Swachh Bharat Abhiyan. Next, we have with us Mrs. Priyanka Barge from Sarthi Foundation. So, Sarthi Foundation is a group of young corporate professionals who came together in 2010 to set up the Sarthi Foundation, to work on initiatives for effecting the positive changes in the lives of the underprivileged children, their families, and communities. Sati Foundation is a not for profit organization working in India for 10 years, focusing on elevating poverty and social injustice. They do this through well planned and comprehensive projects in health, education, livelihood, and disaster response. Their overall goal is the empowerment of women and girls from poor and marginalized communities, leading to the improvement in their lives and livelihoods. Would just like to let you know before we get started, if you all have any questions during the presentation, you can bring them up after we end the presentation. Now, without further ado, I turn the time over to Dr. Pranay. Thank you.
Thank you so much. I'll just share my screen. Is my screen visible?
Visible, sir.
Yes, sir.
So thank you so much, GS Finserve, for organizing this event and giving me this opportunity. Thank you also, Wockhardt Hospital, for this opportunity. I am extremely fortunate for having shared the stage with Mr. Rohidas Lokhande, Namaskar sir, and Mrs. Bagre, and thank you so much for all the amazing work that you're doing in the field of women's health. Before I begin, I would just like to share my gratitude towards these two big institutes where I did my training from. That's St. GS Medical College and KM Hospital, Mumbai, where I did my MBBS from, and the Grand Government Medical College and JJ Hospital, Mumbai, where I did my training in MS Obstetrics and Gynecology. Whatever I am today is all thanks to these three mentors that I've had the opportunity to train with. That's Mr. Dr. Amir Marashi, where I did my training in cosmetic gynecology in New York, USA, and with Dr. Sanket Pesat and Dr. Deepak Limbacha, where I trained in advanced laparoscopic and hysteroscopic surgery. Having said that, let's move on to the topic for today. That's heavy periods, those that don't stop. Periods is something that every woman experiences once a month. However, it is one thing that the women is not looking forward to. Periods is like that one annoying friend that the girl has, who when arrives, you are like, "Arey yaar, fir se aa gaya." And for those women who are not expecting a pregnancy, a missed period is another headache altogether. So periods form a very integral part of a woman's health and biology. It is so well linked with her health that little bit of disturbance can also lead to problems. So coming back to the slide, let's talk about something that a lot of women are actually embarrassed to talk about and share. They in fact neglect it, overlook it so much that until it starts affecting their health. So let's try to get rid of this embarrassment and let's change the slide. Now you may replace the word friend with whoever you want. It could be your husband as well. Just saying. Now what makes periods worse is when they start getting heavy. This brings a big toll on women's health, so much that she is so exhausted that at times doesn't even have to go to work. And for those women who do actually make it to work, feel so exhausted, they lack the concentration and cannot really put in all that they can at the work. This leads to irritability at home as well, and the brunt is faced by the husband. And when he doesn't understand it, it just blows out of proportions. Some women experience immense excruciating pain as well during periods, so much so that they cannot carry out the daily routine activities. She has to spend almost sometimes an entire week in the bed. So let's try to break this thing down. Let's try to understand it from the very basics. Why this happens and how we can actually tackle it. So coming to the anatomy of the female reproductive system. This is the body of the uterus. This is the endometrial cavity. This is the cervix or the mouth of the uterus, the vagina. There are a pair of ovaries and a pair of fallopian tubes by the side of the uterus. Now, the periods which happen are actually because of growth of the endometrial lining inside the endometrial cavity. And this, at the end of the month, falls and comes out through the vagina, leading to periods. Now that we've understood what really makes the reproductive system, let's understand how the periods actually happen. So the menstrual cycle is divided into 3 phases. The first phase is called the proliferative phase or the growth phase, lasts for around 14 days, and is under the influence of the hormone called estrogen. The next part of the cycle is called the secretory phase or the stabilization phase. Now, this one is under the influence of the hormone called progesterone. And finally, the last 5 days of the cycle is called the menstrual phase when the periods happen. So imagine the endometrium like a brick wall. Estrogen is the hormone which lays down one brick at a time on this wall, increasing the height of the wall. As we move towards the second half of the cycle, the progesterone hormone comes into play. Now, this hormone has a very specific role of actually cementing this wall. So by cementing, it actually adds stability to the wall. But towards the end of the cycle, what happens is the level of progesterone starts decreasing. And you can imagine what happens when the stability is lost is that the wall starts falling and giving way. That's how periods happen. However, slowly the estrogen levels start again increasing, which then by its function, adding one brick at a time, stops the bleeding, and the cycle then keeps moving on and on. So now that we've understood how periods actually happen, let's try to define what normal periods are. So the menstrual cycle usually is around 28 days long, give and take 7 days. So that's around 21 days to 35 days. The flow duration is around 5 to 7 days. The amount of blood loss that actually happens is around 80 ml. Now, this is actually very difficult to calculate. So on an average, on the first day, the women usually soaks around 1 sanitary napkin. On the second and the third day, roughly around 3 to 4 napkins. On the fourth day, around 2 pads are used. And on the fifth day, maybe just 1 pad could be used. Also, there is some amount of pain associated with periods on the first and the second day. Now, what are abnormal periods then? So periods which actually come very frequently, so that is they come every 15 days or twice in a month, that's abnormal. Also periods which have come delayed, so that's around 1.5 to 2 months, that's abnormal as well. Periods which are associated with prolonged bleeding, so that's more than 7 days of bleeding, that's not normal. Those were associated with a lot of blood clots, that is also abnormal. Another thing to note is that periods which happen with just a little bit of spotting, so a little bit that happens doesn't soak, sometimes soaks only 1 or 2 pads, that's not really normal as well. And finally, the ones which are associated with immense amount of pain, so much that you cannot walk at all, that's abnormal too. Now, heavy periods or these abnormal periods are more common in the age group of 15 to 55. Globally, they are so common is that around 9 to 14% of women have it. But in India, this prevalence is more. It's almost 18%. And by that, it's actually 1 in every 6 women having this problem. And you know it, if you're one of them, you know how troublesome this is. The complications that can happen because of a lot of heavy bleeding is anemia. Now, anemia is basically decrease in the blood's oxygen carrying capacity. That means that your body will not get enough oxygen even if you're breathing it well. So the hemoglobin is the one which actually decreases. This usually leads to a lot of generalized weakness, easy fatigability, that means you get tired very easily. There is lack of concentration, irritability, like the things I already mentioned. Sometimes, however, if the bleeding is so much that the woman may land up in shock and there is fall in her blood pressure. This amount of bleeding can be so severe and critical that the women may have to be even admitted in an ICU. They may have to be transfused with a lot of blood as well. This can also lead to heart failure. And when going unnoticed, it can also lead to cancer. Now let's try to understand what causes this amount of heavy bleeding. So the International Federation of Obstetrics and Gynecology, this is like a motherhood society for obstetrics and gynecology. So they brought out a classification, a very simplified classification in 2011, dividing the causes into structural and non-structural causes. Of these, the most common one is the ovulatory dysfunction, which is followed by the polyps and finally by the fibroids. So now let's look at a few of these in a little bit in detail. Now, what is a polyp? A polyp is basically like an overgrowth of the endometrial lining, as you can see here. It is the most common structural cause of abnormal uterine bleeding. Polyps rarely cause heavy bleeding, but what it actually causes is continuous spotting or continuous staining of the pad that happens. Now, this can be prolonged, going up to even 15 days, sometimes even after a month. It stops for 7 days and then restarts again. So this is the really annoying kind of bleeding that happens. And the woman is actually quite perplexed. She doesn't know when she'll start bleeding and when she'll stop. So she has to keep wearing a sanitary napkin with her almost every day. Uh, Polyps can also come in way of fertility. That means if a woman is planning a pregnancy, the polyps can come in the way of that as well. The next common cause is fibroids. Now, fibroids are non-cancerous growths. So basically, it's not cancer, but they are growth of the muscle of the uterus. Now, I know this picture looks really scary, but trust me, fibroids actually look like these. It's very rare that a woman can have so many fibroids, but more commonly, she can have around 2 or 3 fibroids. Its size may range from few sub-centimeters, so that's maybe around 5 millimeters or something, to going even as big as 10 centimeters. It can be in various positions. For example, this one, which is a subserosal fibroid, which is inside the cavity of the uterus. This fibroid, which is an intramural fibroid that is inside the wall of the uterus. And this one, which can be seen here, is called the subserosal fibroid, which is outside the wall of the uterus. Now, fibroids typically cause a lot of bleeding. So much bleeding that the women has to change a pad every couple of hours, every hour, in fact, sometimes. And it is also associated with a lot of clots. There's a lot of prolonged bleeding. Also, the bleeding may go up to 15 days or even at times a month. Also, fibroids cause a lot of pain during periods. The other interesting part of fibroids is because of the sheer size, the bigness, because they're so big, it can press on the urinary bladder, which is just in front of the uterus. What happens because of that is that the woman feels that she has to go and pass urine very frequently. Every hour she feels that she's full and she has to pass urine. And she doesn't get that normal feeling of completely evacuating her bladder. Similar problems happen if the fibroid is falling on the bowel, which is present, or the intestines, which is present just behind the uterus. That leads to complication. Fibroids also come in way of fertility. Adenomyosis. Now, this is a very interesting problem. Now, what happens is normally the endometrium is the lining of the uterus, which is present inside this cavity. Sometimes this endometrium starts growing inside the wall of the uterus. That's these blood bubbles that you can see over here. Now, this endometrium, which is in the wall, is still active. So it still grows like how the brick wall grows. it stabilizes and then it falls. And there is bleeding that happens inside the wall of the uterus. Now you can imagine because of this, it causes large and extreme amounts of pain. Very painful periods is what is brought about by adenomyosis, even more than what is caused by fibroids. And they also cause heavy bleeding. Also, this problem as well comes in way of fertility. So women who are planning a pregnancy, this is not healthy. And finally, the last structural cause that is malignancy. As the name suggests, it is cancer of the endometrium. Now, this problem is actually common more than 50 years of age. It is associated with obesity, with diabetes, breast and ovarian cancer. So what I mean by it basically causes something called the postmenopausal bleeding. Now, what postmenopausal bleeding means is that once a woman stops her periods, so that is roughly from around beyond 50 years, if she stops bleeding and she's not got her periods for almost a year, that means she's attained menopause. But if she starts bleeding again after a year, then that is called postmenopausal bleeding, and that has to be investigated for cancer. However, it can also cause normal amount of bleeding in the younger age group, which is similar to what is seen by the polyps. Now, very interestingly, malignancy or the endometrial cancer is associated with a precancerous condition called endometrial hyperplasia. Now, what I mean by precancerous is that this is an early stage of the cancer, and this is usually seen at 40 years of age, so that's 10 years before. And when it is caught at this age, it does not progress to cancer. So this is something that is beneficial for its early detection. Coagulopathy. Now, this is not a very common problem, but it is actually common in very young women. So really young girls face this problem. Now, what coagulopathy usually means is that there is a problem with the body's own mechanism to stop the bleeding. It is seen in very young girls, as I mentioned. The first ever period that she has, that's around 12 to 13 years of age, is very heavy. And the following periods are quite heavy as well. Excuse me. So this is something called as puberty menorrhagia. The girl also faces a problem called easy bruisability. So she gets easy bruising, and it's usually a genetic problem. And finally, the ovulatory cause of abnormal bleeding, which is the most common cause. Ovulatory causes usually doesn't bring about heavy period, but it causes usually scanty period, just a little bit of spotting. It's more commonly caused by polycystic ovarian syndrome, which is very well commonly known these days, obesity and ovarian cysts. So how do we approach these problems? So if a woman with heavy periods comes to me in my clinic, I take a detailed history. So I ask her about when her last period was, how heavy the period was, what was the duration of periods, whether the cycles are regular, whether they are painful. So all these details are very important. We will record your age and weight, and trust me, we are not going to share it with anyone. Your data is safe with us. We will bring about a complete gynecological examination too. There may be a few blood tests to be done, like the complete blood count and some hormonal tests. And finally, an ultrasound or the sonography may be required as well. Now, the treatment of this problem depends on what age the girl presents to us. So when a very young girl, so around less than 20 years of age, so that's called the pubertal age group. When a girl in this age group has a lot of bleeding, we are very conservative with our treatment. We treat almost completely by medicines, and they all respond well to medicines. As I mentioned, coagulopathy, which is very common in this age group, has to be evaluated and found out. Next, we come on to the group which is around 20 to 40 years of age, which is the reproductive age group. So this is usually the time when women get pregnant. Pregnancy also can lead to heavy periods. Yes, and that is a complication of pregnancy, and hence that has to be ruled out in this age group. The next age group is 40 to 55 years of age. That is the premenopausal age group. Now, most amount of heavy periods happen in this age group. So women who have a lot of bleeding in this age group should definitely consult a gynecologist. And finally, we move on to the post-menopausal age group that's more than 55 years of age. As I mentioned earlier, this is the age group where cancers are more common. So any amount of bleeding, even if it's a little bit of spotting that happens once the periods have stopped, they should report to a gynecologist to evaluate whether there's cancer or not. Now, almost all of the causes which I mentioned right now can be completely and very well treated by medicines and medicines alone. So these usually are the non-hormonal medicines. So the non-hormonal medicines are usually the ones that are given during the periods to stop the heavy flow. They also include certain iron tablets to regain the blood that is lost during the period. Sometimes the non-hormonal pills do not really act, and hence we have to move to the hormonal medicines. Hormonal medicines have to be taken usually for a prolonged duration, sometimes for 3 months, 6 months, or even for a year. Unfortunately, we also have women who present to us in a very critical condition where so much blood is lost that we have to start them on injectable therapy. That is, we have to give them injections to increase their blood. And at times, as I mentioned, the bleeding may be so heavy that we have to even admit them and give them blood transfusion. Women, we do not like to do this. Please don't present or go to a gynecologist when the condition becomes so critical. Giving blood transfusion is not the treatment, and we do not like to do this. So please reach out to a gynecologist as soon as you get a lot of heavy bleeding. Now, there are a few conditions which are very notorious and very resistant to medical therapy. Even if the medicines have been given for a long time, they still recur. The problem still comes back. And that's when the surgical therapy comes into play. These conditions can be treated very more effectively by surgery. These are usually the structural causes, that's the polyp, the fibroids, adenomyosis, and the cancers. Now, keeping the cancers away, the first three problems also are treated very well by medicines. So we give them medicines and the symptoms almost completely disappear. But as I mentioned, they're a little resistant to medical therapy, and hence maybe after a year or two, the symptoms again come back. But now the surgeries have become so very friendly. There's something called as minimally invasive surgery. The technology has advanced so much that we've moved on from this blood splattering surgeries which cause a big ugly scars on the abdomen, like this scar that is seen here, something which is seen like in a cesarean section. So these big scars, sometimes even a vertical scar has to be given to do the surgeries. So we've moved on from this ugly looking scars to almost completely bloodless, almost completely pain-free, and almost cosmetically looking scars, which is done by something called as laparoscopic surgery. You can see these scars are so small and they almost completely disappear. So what is laparoscopic surgery? Laparoscopic surgery is basically performed using this instrument called the laparoscope. It's a kind of telescope. It's only 1 centimeter in diameter, so maybe as thick as my finger. We introduce it inside the abdomen like this. There's a small camera attached to it, which goes to a monitor screen, and we do the entire surgery looking at the monitor. So this is an example of a laparoscopic surgery that we recently performed. Now you can see these are very big fibroids that this lady came to us with. This fibroid is almost around 6 to 7 centimeters. So she had two over here on the front of the uterus. There was one big fibroid here behind the uterus and two small here. This is the normal uterus. So we performed this surgery almost completely completely performed it by laparoscopically. We removed all these fibroids. We brought the uterus back to its normal size. And the lady was sent home the following day, and her symptoms almost completely disappeared in the next cycle. The other form of surgery is called the hysteroscopic surgery. Now, this is performed using a hysteroscope. You can see it's only 2.9 millimeters in diameter. That's less than a centimeter. It's that thin. So So that is introduced inside the uterus like this. We attach again the same camera, which goes to the same monitor, and we see everything that's there inside the uterus. So this surgery is usually performed for problems like the polyp. Now you can see here, this is the normal endometrial cavity. You can see it looking normal. There is no abnormality that can be seen obviously here. This is the polyp, which is like a tongue-shaped abnormality that can be seen. And this is removed by a surgery called the hysteroscopic polypectomy. So these are really thin and tiny scissors that we introduce inside the uterus. We cut the polyp off and we remove it completely. However, there are a few problems which don't just respond to medicines. And ultimately, a woman has to undergo hysterectomy. Hysterectomy is removal of the uterus. Now, this is usually performed in a lady who has a lot of bleeding, who's not getting relief with medicines, and she doesn't want any children. She's already completed her family life. She's got around a couple of children or maybe more, and she doesn't need her uterus anymore. So what we do is we perform the hysterectomy is we remove this part, that is, we remove the uterus, we remove the fallopian tubes as well. Excuse me. We leave the ovaries back. And this surgery is also performed completely by laparoscopic surgery. So laparoscopy has a lot of advantages. It produces only keyhole abdominal incisions. So if you can imagine what a keyhole is, it's very tiny, just half a centimeter or maybe a centimeter long. It's near completely painless surgery. The scars which it produces are extremely small and they're cosmetic. There is minimal amount of blood loss. There's quick recovery, minimal hospital stay. Our patients usually go home the following day after surgery. May have to be there for another day as well, but more or less it's the second day of the surgery that she goes home. There's faster resumption of work as well. So these ladies, once they get home, they can perform all of their activities, all their routine activities. There is not amount of a strict bed rest or anything of that sort required. We usually advise them weeks off from work, but they are almost completely normal. In fact, I have had patients after surgery who tell me that, doc, I don't even feel that something has happened to me. There's been no surgery that's happened. I feel completely painless. However, why do we need to reach this stage? Let's talk a little bit about prevention. How can we prevent all these problems? Let's stop being reactive and let's start being more proactive towards our health. So the female reproductive system and all the periods are actually in a very tight and complex control of hormones. And it's basically the hormonal imbalance which leads to almost all of these problems. And as it can be very easily and obviously concluded that a healthy lifestyle translates to healthy hormones. So let us take a moment and say completely no to these really delicious foods that we enjoy every day. And let's move on to a very healthy diet, which is full of nutrients. Let's get ourselves involved in some sort of sport activity, some sort of fitness activity. Now you'll tell me, how can we move out? There's a complete lockdown that's happening. There are so many regimens available online that you can completely do your workouts at home. So that now nobody can give me an excuse that I cannot work out. You can easily do all your home workouts and still remain fit and healthy. So women, your body is your temple. This is something that you have to really look after. Let's make your health a priority, because only if you are healthy, the others around you will be healthy as well. Let's move on from these complex and irritating problems to a more healthy and a happy lifestyle, not just for yourself, but also for others around you, for your family, for your husband, for everyone at workplace as well. Nowadays, women have performed so many roles every single day. She may be the CEO of a big company, but at the same time, she's a mother, she's looking after a child, she's working at home. There are so many things that she's performing. Initially, it was men who were actually looking after the financial growth of the family, but now that's not the case. Women have gone much beyond men. They've got even better than men at so many aspects in life. So let's try to overcome these problems. Let's not let these very inherent and simple problems that you have that with your body of heavy periods, and let's not let it come in way of your greatness. Let's convert these let's convert these common heavy period problems to uncommon ones. Let's make the health of women a priority, and let's make this world a better place. Thank you so much for a patient hearing. I hope I have tried to explain a lot of things, and I hope I've made a lot of things clear as well. Thank you so much. If there are any questions, I would be really glad to answer them. Thank you. Over to you, Shiva.
Priyanka, I have one question. As you said, the last option is removing uterus. Can you hear me?
No, could you please repeat?
I was saying the last option, as you said, I mean, after 55 years or 60 years, is the removing uterus because of heavy bleeding and all. So
Correct.
I just want to ask that if we as a woman removing the uterus, is there any side effect after 55, 60 years, which many ladies are facing after removing the uterus?
Good. I'm very glad you asked this question. So I actually was trying to include this in my talk, but I'm very happy that you asked this question. So I also get this question from a lot of my patients. They say that, doctor, I will become fat. Mera wazan badh jayega. I won't be very happy after I remove my uterus. But that's not really the case. Now, to explain this in very simple language, is what happens so before you underwent a hysterectomy, there was a lot of bleeding that you were having, a lot of bleeding, a lot of blood loss. But at the same time, you're still eating your normal food. But after the hysterectomy, your bleeding completely stops. There is no uterus, so there are no periods. But if you keep eating the same amount of food, you're obviously going to gain weight. You have to maintain a healthy diet and a healthy lifestyle even after the hysterectomy. And coming to your question, there are actually no problems or no side effects of a hysterectomy. The main functions of the health of the women is brought about by the ovaries. The ovaries are the ones which produce these hormones, which are very important even after menopause for the women. So those are the ovaries are usually not removed unless there are some obvious problems in them, but those are untouched, and hence there are absolutely no problem at all that a woman can have after a hysterectomy. The main thing is that her main problem of heavy periods will be completely solved and she can live a healthier life. I hope I've been able to answer your question.
Yeah. Thanks a lot. One more question I had. I mean,
Yes,
after delivery, I think ladies are getting periods after 1 year, or we can say after 6-7 months. But then that
correct.
period is there with the person or the lady is almost 1.5 months. So even though if she is getting a period after that, also it will take 1.5 months for next 5-6 months. So in that case, also is it a uncommon or?
Yeah. So now that's also a very important question that he brought about. So during the pregnancy, there have been no periods for 9 months, and even after pregnancy, after the birth of the child, the woman is breastfeeding. Now, breastfeeding actually stops the periods from coming. It's sort of like a natural contraception. Is that the body is not making, the body is rather making sure that you don't get pregnant again. So It's actually absolutely normal to not have periods for 6 months, and sometimes women don't even have periods for a year or year and a half after the delivery. And the periods which come after that sometimes could be even heavier than normal, and sometimes they can be irregular. But that's absolutely normal. As long as you are breastfeeding your child, you don't have to worry about the periods. If they are irregular, that's fine. If they're a little heavy, that's also okay. But if they're very heavy, then again you have to get treated. But it's very important to continue to breastfeed your child. That's very important. Don't think that I'm not getting periods properly and that's I'm blaming it on the breast milk and stop breastfeeding, then that's wrong. You have to breastfeed your child until almost 1.5 years or so, or 1.5 to 2 years. So that's normal. What the
Thank you.
question is.
Thank you so much. I don't know, I'm asking multiple questions. I'm so sorry for that.
No problem.
But then
No
one
problem.
more question I have. Sometime what happened, this is personally it happening with me. Sometime I'm getting period for 5, 6, almost 7 days. But some of the month I'm getting only for 2 days. And with very, light or less periods. So is it normal or else I should consult with gynecologist and I should ask the question?
Correct. So like I mentioned, so if the bleeding is for 7 days or within 7 days, that's normal. So only if it's getting very heavy, then you should consult a gynecologist. If it's a little bit of spotting that can happen, that can be abnormal, but there can be various simple causes like there's stress at work, stress at home, you've not had a healthy routine, then the periods can get a little irregular. They can have less amount of bleeding. So this is all related to the hormones. So and which again are very well related to the stress level. So if it's little bit of bleeding, little bit of small amount of bleeding, then that's normal. So as of now, I don't think you should visit a gynecologist. Don't worry. Only and only if the bleeding becomes heavy is when you should.
Thanks, Pranay. It was really helpful, and I'm glad I attended this session. Thanks, Jaspreet, also arranging for this session. Thanks a lot.
Pleasure, ma'am. It's
My
our
pleasure.
job and duty towards the community. Thank you.
I do have a question.
Yes, please go ahead.
So yeah. So my mom, so she has again this fibroid issue. So I think it's larger than 10 centimeter in size. So this is happening since 6 months, the last 6 months. So when we consulted 2 doctors, they said that hysterectomy would be the ideal choice for her. She's 52 years of age, and post that the doctor said that she's nearing your menopause. So they have given her leukeroid injections, but post that also now she has got her periods. So those 3 months of those leukeroid injections, she was completely okay, and now again she's having heavy bleeding. And so what do we do now? So what would you suggest?
Right. So like I mentioned in my talk, fibroids are very notorious. So they initially respond to medical therapy and ultimately they stop responding. So if the bleeding is still very heavy and very troublesome, then I think the best option would to undergo the surgery and not waste her time until she's believes that she's gonna stop having the periods. Because even though she's almost more than 50 years of age, you still don't know till when. So a lot of women continue to have periods till 55 or even 60 years of age. So that's it's still she will still be losing blood and large amount of blood every month. So it's actually advisable now because she's already taken medical therapy which has not worked, then to undergo surgery will be the best option for her.
Okay, thank you so much.
My pleasure.
So Neelam ma'am has raised her hand.
Yes, Neelam, go ahead. You'll have to unmute yourself.
Am I audible?
Yes.
Yeah. Hi. I just wanted to know your take on menstrual cup. Is it a good thing? Is it a bad thing? Is it better than a menstrual pad, or how is it? And does it affect any part of it all?
So menstrual cups are absolutely healthy. They don't cause any problem. You're actually very safe to keep to have the menstrual cup inserted inside the vagina.
Okay.
It doesn't. The advantage is it doesn't keep soiling the pads and even the clothes.
Yeah.
And there are little ways of how you can clean the menstrual cup.
Yeah.
You have to boil it, and it depends on that. But they're extremely safe. There are no problems at all. And in fact, they have actually made lives of a lot of ladies very, very simple.
They really have, yeah. So I just wanted to know if there are any disadvantages of that.
So if the lady has some infection in the vagina, then I would like to treat the infection first. Then I would advise her to use the menstrual cup.
Okay.
So before any lady actually thinks of undergoing using the menstrual cup, you can evaluate for yourself. If you're having a lot of vaginal discharge, a lot of itching, then consult the gynecologist, get yourself treated, and then you can use the menstrual cup. There's no problem with it.
Okay, great. Thank you so much, Dr. Pranay.
My pleasure. My pleasure.
Dr. Nisha ma'am has asked a question in the chat box. Do you want me to read the question?
Yeah, please go ahead.
Do you recommend consulting a doctor for considerably painful periods, which makes you unable to move around, really exhausting for people under the age of 20?
Hello, Nisha. I'm very happy that you asked this question. I get so many women, so many girls who are less than 20 years of age, so many young girls having this problem. Now, painful periods is a different topic altogether. But as I mentioned, it could be because of fibroids, because of another problem called endometriosis. I don't know if you've heard of this problem, but this problem has also started coming up very recently. A lot of girls are suffering from that. So anything which you cannot bear and you have to stay at home, you cannot carry out your daily activities, you have to keep taking medicines for the pain, then I would definitely recommend you to go to a gynecologist and get yourself evaluated. Because if this problem has been found, it can be solved completely and you can benefit a lot from the treatment. So yes, I do recommend that you should consult a gynecologist for having so much pain during the periods.
Thank you so much, Dr. Nisha ma'am. So there is one.
Myself, Nana. I just wanted to ask, I am 14, I have completed 40 years of my age.
Yes, go ahead. Nana, I think we lost you. Can't hear you.
Hello?
Yeah, we can hear you now.
Yeah, from last 13 years after my delivery, I am getting periods. First and second day is normal. After that, third, fourth, fifth day, it's just like spotting till today. Is it normal or should I consult some gynecologist?
So your periods go on for how many days?
First and second day flow is proper. After that, third, fourth and fifth day, it's just like spotting. I don't have to even keep the sanitary pads.
So the periods stop on the fifth day?
Almost, yes.
So then that's absolutely normal.
Yeah.
You're perfectly normal, nothing to worry about.
Okay.
Just make sure you maintain a healthy diet and get yourself in some sort of workout activity.
Yeah. Yoga, I am doing
Keep
almost
yourself
from
healthy.
last 10 years. It's been continuous.
That's fantastic. That's fantastic. You're absolutely normal, nothing to worry about.
Yeah. Okay, sir. Thank you. And thank you for such a wonderful presentation. Got to know many new things which we were not aware of it.
My pleasure. My pleasure. Thank you. Thank you. I'm glad I could help all of you.
Dr. Dhara ma'am has raised her hand. Dhara ma'am, you can go on.
Good afternoon, doctor and
Good afternoon,
everybody. I just wanted to know that past 1.5 year, I have been facing an issue that is, in starting 2 to 3 days, first day I get a spot, and after that for 2 to 3 days I do not get any bleeding, and the pain is still so bad. And after that I get like bleeding for 2 days, but which is unbearable, as well as I can't, I have to change twice or thrice the pads also in a day. So the bleeding is also too much, the pain is also unbearable. Few people tell me that it is not good, that it has become reverse. So what is it like? Because I cannot understand what am I supposed to do now, of the pain also and the reverse cycle also.
I know, I know. Have you, I really recommend that you consult a gynecologist for this problem. You should,
Okay.
and you should get yourself evaluated. Maybe get an ultrasound scan done to find out if there is any structural problem with the uterus, and get yourself treated. This is not normal. You should not have so much pain and bleeding during the period.
Okay, and one more question. Thank you so much, doctor. And one more question. I have a daughter, and what is the ideal age of getting chums, like getting periods? What is the ideal
Correct.
age? And if they get before that, what can we do to delay it for some time? Like she's 9 years old, but she's a bit healthy.
Oh,
You see?
okay. Right, right. So 9 years is quite healthy. It's usually from 10 years to 15 years is usually. So this is a little early.
I think she
But
hasn't
again,
got
now,
her chums as yet. She's not got her chums
okay,
as yet.
okay,
But as she's healthy, I'm a bit worried about that she might get it in a year or so. So is there any
right.
way out that I can still delay it so that she does not get it early? Or should
So
we?
unfortunately, there is nothing in which way you can delay the periods. The first period that you mean, that's called menarche actually in our language. So there's nothing to really worry about. Had she been having her periods at 9 years of age, then I would have told you to really consult a gynecologist for it. But if she's if she's beyond 10 years, then that's okay. So these days we are getting a lot of girls who are having periods very early. So which it could be even normal. So don't worry about it. Even if she starts getting her periods by the time she turns 10, that's okay. As I mentioned, if the periods become very heavy, then you may have to consult a gynecologist. The other thing I would like to just advise you is that she may not have regular periods. So she may not have monthly periods to begin with. She may have periods every couple of months, or once in 2 months, or maybe once in 3 months. That's sort of okay. That's normal. We don't really need to treat that because this is called the pubertal age, and a lot of hormones are spiking. So a lot of things needs to come. It'll come into a balance by itself. So you don't really need to do anything. Even if she gets irregular periods, that's fine. But if the periods are heavy, then yes, you need to consult a gynecologist.
Okay, thank you so much, doctor.
My pleasure.
Dr. Sheetal ma'am has a question. Nowadays, the puberty age is earlier, so the girl's getting period at the age of 12 years. So is it normal?
So in fact, 12 years is a normal age when a girl starts having her first periods. And as I just mentioned, the the age by which women, so if it's even at 10 years, girls can start having their periods. So we've got so many patients who've had periods at 10 years of age. We've found out everything. We've investigated them. We've not really found any problems. So it's just the evolution, or that's how things have become now that the periods are coming earlier. But it's absolutely normal. There's nothing to worry about.
Thank you, doctor. Doctor, there's one more question from Soham. How can men help women during these days?
That's a very important question. I'm very happy and very glad that you brought it up. Now, this, like I mentioned in my presentation, is actually a very stressful period for women. even if you're not, even if the girl isn't having heavy periods or a lot of pain, it is still very stressful for them. The hormones are very low and makes them still getting very irritated. So you have to be very understanding with your ladies. You have to be very calm. She may she may get irritated at you for things which are very irrational, but you still just have to keep your calm. Try to understand her. Try to support her all throughout, and it'll just lead to a very healthy relationship. It's actually very unfortunate that women has to go through this and men don't feel anything, but this is the best, or this is the best and the least thing that we can do to help our ladies.
Thank you, Doctor. Dr. Jasbir Kaur has raised her hand.
Yeah.
Yes.
Am I audible, Doctor?
Yes, you are.
Yeah. Hello, Doctor. This is Jasbir here. I had undergone ovarian dermoid surgery 2 years back. My question to you is, does it affect your cycle, this period cycle? What I am focusing is, I am facing heavy periods after my surgery. And as I consulted my doctor, he said, this is just you are, thinking. It is nothing like that. But kindly help me if I am right or wrong.
Right. So dermoid is a very different and a special problem that happens in the ovaries, but it doesn't really affect the menstrual cycle. What at most it can do is it can bring about irregular periods. So that is, the periods can be delayed. In the sense, you can have periods for once in 2 months, or something like that's not every month. But it usually doesn't cause heavy bleeding. It's so the heavy bleeding that you're having right now, it's not because of the dermoid or the surgery. It could be a very different cause of the heavy period. So you should get it treated and evaluated why you're having heavy periods now.
Okay. Thank you so much, Doctor.
My pleasure.
Dr. Shubham Tiwari has raised his hand.
Doctor, I want to say that I got period twice a month and now I am suffering from MDR disease.
Sorry, which disease? I didn't catch that.
MDR, tuberculosis, type of tuberculosis.
Right. MDR-TB, yes. Correct. So now, is that all, or you have a little more to your question?
So my question is, I got period twice a month. So what's problem?
Correct. So the MDR tuberculosis brings about a lot of changes in the body, and it causes a lot of hormonal changes as well. But besides the hormonal changes, it just brings a lot of stress to the body, and it could be because of that you could have had periods twice a month. But if the period, I think you can observe for 1 or 2 months, you see how your periods are. If the periods still keep coming every 15 days, then you should visit a gynecologist and find out what the problem is. But once a while, something like this happening, it can be because of the TB and not of any other reason, and it could probably resolve on its own. So I would advise you to just observe your periods, maintain a menstrual calendar. That means you try to mark the days that you've had periods, and then maybe after 2 or 3 months, evaluate yourself, how frequently you've had the periods, and then maybe take a decision.
Okay, thank you.
My pleasure.
Kashish, you can proceed.
Hello, doctor. Good afternoon. My mother has a question. She is a thyroid patient and she stopped her periods at the age of 45. So she wanted to ask if that is normal or does she have to consult a doctor?
No, so that's absolutely normal. 45 to 55 years of age is called the perimenopausal age group. So that's the time in which ladies usually stop their periods and reach menopause. So it's absolutely normal. If she's healthy otherwise, there is no other problem, then there's nothing to really worry about.
Okay, thank you so much.
My pleasure. I'd just like to take one question which is brought out by Nikita Gala. She's written, have I think she says she has fibroids. So is it necessary to completely remove uterus or just hysterectomy is fine? I would just like to correct you. Removal of the uterus is called hysterectomy. So if you mean by this is just removing the uterus is fine, just removing the fibroid is fine and keeping the uterus, that's absolutely okay. We can just remove the fibroids and we can keep the uterus as it is. But it is just in generally advisable that if you've completed your family life, you don't really need the uterus anymore. The uterus's main function is to bring about periods, and second is to have growth of the child, of the baby, of the fetus. So if your family is completed and you are above 40 years of age, and you've got a lot of fibroids and associated with heavy bleeding, then it is advisable to undergo a hysterectomy and remove the entire uterus. I think I've solved I hope I have solved the query.
Excuse me.
Yes, Mr. Himanshu, please go ahead.
Yeah, I'm talking for my daughter. She's 26 years old at the moment. And she started the same problems which I've been hearing since the beginning of your meeting. Right. She started, and I think she has PCOD. Yeah. Okay. And for 1.5 years, when she was 13, the bleeding continued. Then we went to gynecologist, who gave some 21 or 24 days cycle medicine. Right. And she did it. When she does it, the bleeding stops. But in the side effect, she gets too much depressed. And she was a very young student at that time. Right. And I think we went to about 3 to 4 gynecologists for it. But the same cycle and the same thing, nothing else. And she is fine till she takes that. And then again, she goes into the depression. So what is to be done for it? Right. So the PCOS, which is the short form for polycystic ovarian syndrome, this also is a very common problem that a lot of girls have these days. It's as common as 1 in every 5 girls having it. Now, PCOS, the main problem in PCOS is that there is a lot of hormonal imbalance. And unfortunately, that could be corrected by the medicines that you just mentioned for 21 and 24 days. And they are given for 3 months. And till the medicines are taken, the periods come regularly. And once the medicines are stopped, again, the same cycle continues. So PCOS is actually a very complex problem. It's very resistant to treatment. But the only actual final way of treating it is consuming a healthy diet and undergoing some amount of physical fitness and to reduce the weight. So usually girls who have PCOS have a lot of weight gain. So if she brings down her weight, she gets into a fitness regimen and she controls the diet, consumes healthy diet, that should help her in the long run. But I would still tell you that PCOS, again, the process is very long. All of which I just said is actually easier said than done. Hello, doctor. But that is unfortunately the only way. Now, can I ask you one thing? That yes, please. This is the thing that for how long she will have to go on, because according to my knowledge may not be full, but these are all birth control pills type of things.
That's right.
And she is yet spinster. So
correct.
As a father, I am really worried about it.
I know. I can totally understand how you're feeling and what you're going through. So as I mentioned, if she actually undergoes the weight training, reduces her weight, and gets into a healthy diet, and that sort of will somehow solve the hormonal imbalance, and that is ultimately the treatment of PCOS. So the medicines that you're talking about, I'll just finish. So the medicine that you're talking about usually give only temporary relief.
Yes.
So roughly for around 3 months or maybe for 6 months, that's all. But that has to be coupled with weight loss and good training, physical fitness and healthy diet. That is unfortunately the only way this will get treated. So PCOS is sort of becomes like a thing of her body, and the only way she can control it is by what I just told you. And eventually it gets treated. It takes a couple of years or sometimes 3 years or maybe 4 years. So it's a long process, but she has to be at it to get it treated.
Yeah, thank you. No, actually, in fact, she would have talked to you personally, but she is not in the country. She is in Canada.
Okay. Oh, okay.
And she is there also. She is going on repeating this dose. But how long? Because this will have adverse effects.
So usually the birth control pills don't have adverse effects. They do, but they're very mild. But as I told you, the actual treatment is something else, and if she follows that, she may not require the birth control pills. That's what I'm trying to say.
Okay. I'm sorry, but I will ask her to contact you at least on phone.
No problem. It will be my pleasure to help her. No problem.
Hello, doctor.
Thank you. Can I have your phone number or anything of that sort?
I'll just share my screen, which has all the contact details.
Yeah.
Doctor, I am the daughter of Suman Raju Aute. She is nurse in your hospital. My doubt is that when I was in 7, my periods had started, and it was regular till my 9th and 10th standard. But now, from 11th standard, it comes only 2 to 3 days only. Why so, doctor?
So, sorry, can you tell me how old are you again?
I am now 18 years, but my periods had started from 7th standard. It was normal running till my 10th standard, and from 11th standard, my periods had coming from 2 to 3 days only.
So 2 to 3 days periods is absolutely normal. There's nothing to worry about. Heavy periods is something that you should worry about, and if you get irregular periods, then and only then you can contact a gynecologist. And I would just stress at this age,
5 to 10 days, my pain is coming. That's why I have that doubt.
You have pain for 5 to 10 days, you're saying?
Yes.
Then I think you should consult a gynecologist and try to find out what the problem is.
Okay, thank you, doctor.
My pleasure. Do we have any more questions?
Sir, is PCOD and PCOS different?
So PCOD is usually related to just something called as the problem in the ovary. It's usually synonymous. You can use both the terms just like that. But to be more very specific, PCOS is a syndrome, and it causes a lot of other problems along with it. Like there is a lot of amount of hair growth that happens, abnormal hair that happens in women, a lot of facial hair, abdominal hair, chest hair that comes. So this comes under PCOS. So, but usually PCOS and PCOD are the same thing when they are interchangeably used.
Dr. Hetal Shah has a question. Her normal cyst dissolved with medicine, but the chocolate cyst is still there. So the gynecologist said it's fine till it's of same size around 2 centimeters. But if it increases, it should be surgically removed. Is there any other way to dissolve the chocolate cyst?
So chocolate cyst is actually also called as the endometriotic cyst. Now, like I mentioned, it's something in the adenomyosis, that the endometrium which starts growing inside the wall of the uterus. But in endometriosis, the endometrium starts growing on the ovaries, and which produces those chocolate cysts. Excuse me. So what your gynecologist has suggested is absolutely correct. By medicines, you can treat them, but the chocolate cyst usually doesn't go away so easily. Only and only if you're having a lot of pain during your periods and you're maybe having heavy bleeding, then the surgery could be done to remove the chocolate cyst. Also, if the cyst starts increasing and goes beyond 3 to 4 centimeters, if it starts becoming that big, then it usually produces a lot of pain. And that is the only reason why a surgery should be done. Otherwise, if it's small and it is not bothering you in your periods, it's not causing pain at all, then you can just forget about the fact that you have a chocolate cyst and you can live your life normally, because it's not really going to cause any problems.
So Hetal ma'am has said that she's having heavy period and it's very painful.
So if pain is your primary complaint, then the cyst can be removed. But it depends on a lot of other things. So I think I can see you said you're 41 years of age. Okay. Right. So if the pain is too much, you can still try with medicines. And if the pain doesn't subside, then ultimately you may have to undergo that surgery. But if the pain can be bearable, you can take medicines along with it. Then if that's okay, then you can, maybe go on for a couple more years, you see how it is. But ultimately, if it's not getting relieved, then the last option is surgery, unfortunately.
Thank you, doctor. There is one more question from Priyanka Barge ma'am. The treatment for PCOD is the same as PCOS?
Yes, it's actually, so as I said, PCOD and PCOS are sort of interchangeably used. So they are like synonyms, they're like the same, they have this almost the same meaning. So the treatment is the same, yes. Do we have any more questions?
I guess that's it. That's it, sir.
Okay, thank you so much, everyone. And I'm really glad that you all asked so many questions, and it just became a more interactive session. I'm very happy to have shared all my knowledge with you, and I hope that all this knowledge would be beneficial to you, and it could probably help you further. It must have cleared you quite a few of your doubts as well. Great. It's my pleasure. Thank you so much. And thank you so much, JS Finserve again. Thank you so much, Mr. Lokhande and Mr. Bagde. Thank you so much for this webinar.
So we just have a vote of thanks. If you can just wait for a second, sir. Ishika?
Sure.
Yes, sir. So I, on behalf of JS Finserve, extend a hearty vote of thanks to all the delegates of the webinar for their presence and contribution to make this webinar exemplary. I extend my thanks to Dr. Pranay Desai, to take out time from his busy schedule to grace the event. Thank you for sharing your knowledge on such an important topic. I would extend my gratitude towards Mrs. Priyanka Barge, Mr. Rohidas Lokande, Mr. Suresh Apte, and also Dr. Neetu Bajwa for providing the support to make the seminar successful, and also to all the other participants. Thank you.
Thank you. Thank you so much.